I'm Lloyd Bradley. I'm the consultant in neurorehabilitation here at St Richard's. I run Donna Wilson House, which is a specialist inpatient neurorehab unit. We have 12 inpatient beds. We also have quite a large outpatient service. The patients are predominantly younger than the average hospital population. We deal mostly with people who have post-acute problems such as stroke, brain injury, spinal cord problems, peripheral nerve problems. The role of the junior doctor is really to do with the management of the patients on a day-to-day basis. These are quite complex patients with very challenging problems. Although the workload is not particularly busy, it can be very difficult on an individual basis. Junior doctors here will have the opportunity to learn how to examine patients and assess them neurologically. We do a lot about chronic pain management. We do a lot about MDT working. We have some very good therapists here that you'll have the opportunity to work with, develop your skills across the MDT as a whole.
The day starts at around 9 a.m. I come in and generally on Donna Wilson House, each and every patient doesn't need a daily review. Usually what happens when we come in is we check with the nurse in charge, particularly on a Monday, whether there's been any events over the weekend that we should be aware of, and daily thereafter, and see if there's anybody that the nursing staff are particularly concerned about who needs review or who's been seen overnight. The other thing we check as well is whether there's any anticipated admissions for the day or any impending sort of discharges that week, so that we can prepare those. Generally, patients on Donna Wilson House are medically stable and they're here just for their neurorehabilitation, but often minor things will pop up, and obviously a lot of our patients are living with long-term conditions, so there is always a risk that something more acute might happen, and in that case we obviously assess them, do all the relevant investigations, or do any bloods, insert cannulas, order any scans as needed. And we know that Dr. Bradley obviously is always there should we need sort of any additional assistance, but the job's really great in that you do get sort of maybe a little bit more independence and gain a bit more confidence in dealing with clinical scenarios on your own, and perhaps a little bit more of a community-based approach, but knowing that you're in the safety of being near the hospital. But that's actually been a bit of a change from working over in the main hospital. You do have that slightly different approach.
The multidisciplinary meeting is on Wednesday morning. That's where all the patients are discussed. Your role will be in terms of presenting the patients and overseeing the medical management, contributing to any particular decisions that are made in terms of the longer term care.
That's really our opportunity as a team of doctors, physiotherapists, occupational therapists, nursing staff and social workers, psychologists, all to come together and discuss holistically all aspects of the patient care.
In addition, the ward round on Thursday afternoon is where we'll go around together and see all of the patients, and again your input there is very important. There are other opportunities throughout the week. For example, we have regular family meetings, progress review meetings. Those can be quite challenging, and I will try and get you to hone your skills in dealing with slightly more difficult situations, which you probably wouldn't get the opportunity to do perhaps over in the main hospital.
On a Thursday morning, we go to neurorehabilitation clinic with Dr. Bradley, which is really interesting. You see a lot of really interesting pathology, and Dr. Bradley will often get you to examine patients in front of him and provide immediate feedback, which is really useful. As I said, you learn so much from that, and he's a great teacher. On the same day at around 1:15 there is the neuroradiology meeting as well, where we go along to a stroke team there, as well as neurologist and the neuroradiologist, and we'll discuss scans over the past week, any particular scans that need reviewing. And with regards to getting scans and things organised, so the nursing staff are great here and will organise transport as needed to go across for scans in advance. But yeah, it is a little bit different being outside of the main hospital setting. The logistical issues in getting patients across for scans does mean that a little bit of planning has to be taken into account. When usually patients are even if they are unwell, they can be managed here. But on the odd occasion, patients may require transfer over to the main hospital for treatment and admission under the acute medical team. So regarding on-call shifts, the way it works is Donald Wilson House, the job itself falls under the kind of general medicine rotation. So our ward job is based here at Donald Wilson and is 9 to 5, and we do the on-call shifts as in any other inpatient ward, so that includes weekend shifts, night shifts.
As the majority of our patients do come from the acute site, when you are away you'll be cross-covered by the F2 doctor working on Lavant, the stroke unit. If it is quiet here clinically and they do need some extra help, you will be expected to go over there and input, but hopefully those skills will be cross-transferable and both of you will get a lot out of that.
At Donald Wilson House, it's sort of fixed annual leave, and with regards to the flexibility of that, I think it would just really be dependent on the ability to find internal cover, or perhaps the ability also to swap with the stroke SHO shifts. That would probably be the most direct swap. For a weekday handover, you can hand over to the evening F1 or SHO regarding a clinical review or any outstanding investigations, obviously giving a good background of the patient when you hand over. For the weekend cover, you tend to add the patient to e-handover electronically and detail any outstanding tasks for over the weekend. You also can attend the Friday handover meeting at 4:30 p.m. on emergency floor, where you give a background of the patient and what needs to be done over the weekend as well.
As you will be the only junior doctor in this post, although you are cross-covered by one of the junior doctors from the stroke unit, there aren't formal teaching sessions. However, you do have the opportunity to come to an outpatients clinic every week, during which time we'll talk about patients and different aspects of their care. I'll try and teach as much as possible on the ward rounds and certainly the MDT meetings, so that you get a good appreciation of patient management in a more holistic sense than perhaps you would on the acute site.
It is a really great opportunity for gaining more experience in working in the multidisciplinary team, and as I said, the role of each of the multidisciplinary team members. They're very keen and lovely and happy for you to sort of observe their work and interact with that also. While
you're here, I will try and encourage you to do as much clinical examination being overseen as possible to really refine your skills in presenting and thinking through pathology. You'll have the opportunity to work with all of the members of the MDT and get experience of patients in all of the different environments that we work with them in. I will try as far as possible to meet your particular educational needs. Lots of the trainees that have gone through the service here have done audits and presentations. One or two have even done posters for national meetings.
Feedback's a really important thing because it helps you to understand what you're doing and how that's perceived by other people. And unless you ask for and receive feedback, you might not know that. So one of the things we're encouraging people to do is simply ask. When you're doing something on the ward, or whether you're with your consultant or your colleagues, you can ask them, would you mind when we're finished giving me some feedback? And most of the time people will do that. They'll say, yes, of course, I'd be happy to. But if you don't ask, it might not happen. And the other thing that's really important is sometimes it's important to give feedback. So the people that are teaching you might not really understand how you perceive them, how you feel they are. It really helps if you can say, would you mind if I gave you some feedback about how that went? Particularly if it's something good. If you give good feedback, it makes everyone feel better. It helps our morale, it helps engagement, so people really want to help you and you can help them. So just say, when we've finished, can I give you some feedback? And I'd be really surprised if they said no.
I am around at St Richard's most of the week. I go to Worthing on a Monday morning. I have ad hoc clinics at other places occasionally. My office is next to your office. If there's any problems, do just come and talk to me about them. And while you're here as your clinical supervisor, I'll try my best to get you through the rigours of the e-portfolio. At
Donald Wilson House, whenever a patient's admitted, we do quite a detailed clerking, and that includes a full neurological examination and formal cognitive assessments and anxiety and depression assessment. So in our clerking, and you can glean a lot of the history and what's happened in the previous investigations from the notes and from the system as well. So it's useful to have a look at that before you go and see the patient. And then it's good to clarify sort of the social history in particular, where they were with their mobility and accommodation prior to being admitted to hospital. And where they are now. A lot of the patients who come in have very interesting and complex neurological conditions, so it's a great learning opportunity, and also you do build more of a relationship and a rapport with the patients. Whilst they may not need clinical reviews every day, it's good to catch up with patients a couple of times a week, perhaps outside of the ward round, which takes place on a Thursday afternoon, just to see how people are getting on. And obviously you'll be involved with the day-to-day management of things like pain control, muscle spasms, and if patients with diabetes, blood glucose control as well. I think Donald Wilson House is a fantastic place to work. We have a great multidisciplinary team. You get far greater insight into how that works and how the other disciplines work, more so I think than any other place in the hospital perhaps. You get a bit more experience in being a little bit more independent in your clinical approach, whilst knowing that you've got the main hospital very nearby, as well as Dr. Bradley being on hand to advise whenever needed. You encounter a lot of interesting, complex pathology, get to build a great rapport with patients, and build a greater understanding of chronic illness, and it's a great educational placement as well. So I'd really recommend it to anyone.
I hope you enjoy working here. I'm sure that you'll get a lot out of it. I look forward to seeing you soon.